Welcome back. I'm Michael Bull, and this is the Commercial Real Estate Show. Today we're talking about healthcare and healthcare real estate. My guests are Paul Zeman and Henry Johnson. And Henry, let's talk a little bit about construction and demand for new supply there. You know, what are you seeing for levels of new construction? It doesn't seem like I've seen that many cranes, you know, around building new buildings. What are new supply levels right now?
Well, probably, you know, a lot of these buildings aren't that tall, so you're probably not going to see too many cranes. But, you know, in terms of where they're going, I think, you know, the dynamic has completely changed, right? So, you know, the medical office building or outpatient clinic is now a new dynamic in the continuum of care, right? So hospitals are kind of thinking through the strategy of how they're going to get out to the neighborhoods. And I think, you know, it's a lot like what retail went through years ago. You know, it's difficult to go downtown to Macy's to buy a tie. You're going to go to, you know, somewhere nearby that, you know, you can get there easy access, easy signage. You can see the front door. So you're not going to see cranes. These are, you know, 100,000 square foot and less buildings that are probably 3 and 4 stories. And, you know, just look around the communities that you're in. I think you'll see out in the suburban markets a lot of these. We do a lot of multi-specialty clinics. So I know Paul has toured one of our buildings recently up in Tennessee, and you know, it was a 250,000 square foot build-to-suit for a multi-specialty practice. So I think, you know, the volume of that has really increased because these buildings that they're in, they get outdated. The technology changes in healthcare, and these folks, if they can't retrofit a building for an appropriate price, they're going to go and build a new facility.
Mm-hmm. Okay. And what are the hot property types and, you know, and uses right now?
Well, we're seeing a number of different trends, and again, that's, you know, healthcare realizing, it's almost like, I hear this a lot, and talking to healthcare systems, they're saying, hey, what is our retail strategy? And that's something that was never used in healthcare before. Nobody referred to a patient as a customer, right? So I think with that in mind, you're starting to see different types of buildings. There's a whole new area of building construction components that you never even saw before in healthcare. So, you know, freestanding EDs is one that's pretty prevalent. We've been involved in probably a half dozen of these. And so, you know, that used to be the first type of project that you would see on a campus, and then it would later evolve. They would build a hospital, they would build an MOB, they would build an imaging center. It would become a huge healthcare campus. But now, you know, these sometimes often look like Chase Bank sites. They're high-end, super high-end retail locations, high traffic. They're doing sophisticated demographic studies to suggest, and these people know when they open the building exactly how busy it's going to be. So
dock in the box, huh? To drive through healthcare.
Well, not dock in the box, but they're very expensive.
Right.
So on top of that, we're seeing, you know, outpatient clinics is probably the biggest term, and I think that's part of this whole continuum of care. Healthcare systems are realizing that, hey, we have to get, you know, a lot of people are referring to these buildings as hospitals without beds because they're trying to see what services can we get out of the hospital and put in a building that costs sometimes, you know, a third to a fifth less in cost. So you're seeing outpatient clinics because, you know, now you can go and have surgery in these buildings. They're having, you know, surgical centers. We're seeing diagnostics, laboratories, multi-specialty clinics. So I think, you know, these buildings cost substantially less to build, substantially less to operate, substantially less to maintain, and probably have less regulatory pressures in terms of who's managing all that from the healthcare system. So that's a big thing. Sports training and orthopedic, we see a lot of demand in big orthopedic clinics, and some of these having their own sports training. You know, a lot of folks, you know, see their kids and, you know, wanting to train these guys to be in Division I sports, and they're spending a lot of money with these sports training groups. So it's interesting to watch them grow. Medical recovery centers, we've been seeing that. So I think as you see the aging population, you're going to see folks, a lot of knee replacements, hip replacements. There's actually facilities that we're talking about that have a hotel component. So these will be, you know, surgical centers with overnight stay. Something we really haven't seen much of before, but that's becoming a trend. Boutique hospitals, we're seeing a lot of that. There's just smaller hospitals that have overnight stay. We'll have ED, surgical center, and hospitals. So we're seeing those that are in higher demographic areas. They're not big buildings. They're probably $50 million and less as opposed to $200 million projects.
And the land is, I guess, a little cheaper on some of these projects, right? It's not just on campus anymore, right, where you had that very high land lease or purchase the land. So it's spreading out across the country, right? You don't have to go downtown and go to the
That's right.
to the campus.
I think you're right. I think a lot of the systems are looking at this as what they call a hub and spoke development, right?
Mm-hmm.
So, what the idea is that you keep the very critically ill people in the most expensive the most expensive per square foot space, which is generally the hospital. You're going to have cancer care, cardiac cath labs, the really, really, really expensive procedures that need to be done. They're going to be in the expensive space, and then things that could be done in a medical office building that is fitted out as an outpatient clinic are going to be done there.
And we're short on the break, but what are you seeing in these properties that you didn't see before? You're seeing more like coffee shops and things like that, and some of the design.
Well, everybody's thinking retail. I mean, again, you're hearing hospitals say customers, retail, that mindset, branding, protecting our turf, if you will. So they're thinking like a retailer, which means you got to have services of a retailer.
Yeah. Well, that's important. Well, stay tuned. We're going to have more on healthcare and healthcare real estate. I'm Michael Bull. This is the Commercial Real Estate Show. We'll be right back. The Commercial Real Estate Show is brought to you by Florida International University and Bull Realty Commercial Brokerage, a great place to do business. For more information on these companies or to access additional podcasts, videos, or blogs, visit commercialrealestateshow.com.